talking about aeromedical factors, and there's a lot of things that goes into aeromedical. But just to start off, we're going to talk about medical certificates and the different types of certificates there are, and what you can do with these different types of certificates. There's also different qualifications that you have with these certificates, and there's different age limits for different classes of these medical certificates. So, just starting off, there are three classes of medicals. There's a first, second, and third class. The third class is going to be what is used for student pilots, recreational pilots, essentially anything that you're not using for a job other than being a flight instructor. A flight instructor can have a third class medical certificate and operate for hire. That's the one exception. Next, there is a second class medical, and the second class is for commercial pilots. So, this is flying for hire, flying persons or property for hire is what a commercial pilot is, and you can do that with a second class medical. Now, finally, what a first class medical is, that is what you're going to use when you are an airline pilot. It's required to be a ATP and air transport pilot is what that stands for. So that means you're carrying over a certain amount of people in your airplane, and that ATP is required for you to be able to carry that many people. Now, the different age requirements. So to have a first class and how long they last, let's just talk about all of that. With a first class medical certificate, if you are under the age of 40, you can exercise the privileges of a first class medical certificate for 1 year. If you're under the or if you're over the age of 40, that year is going to be knocked down to 6 months. So for 6 months, if you're over the age of 40, you can exercise the privileges of a first class medical certificate. Now, moving on to a second class medical certificate, that's going to be 1 year, regardless of age. Now, it changes a little bit when you have to get it updated. If you are over 40 with that second class medical certificate, that is going to give you those privileges for 1 year as a second class. And then the next year, you're going to still have your second class medical certificate, but you're only allowed to operate under third class privileges, which would be you are unable to fly for hire at that point based off of your medical certificate. Um, with a third class, if you are under 40 years old, you have 5 years of your third class medical certificate being valid. And if you are over that 40-year-old threshold, you are going to be limited to 2 years as a valid certificate holder of a third class medical. Now, how these years are broken down, let's say that you got your first class medical certificate and you are under 40 years old. Me, for example, I got my first class medical certificate in February. So, as of March 1st next year, that means that I will no longer have the privileges of a first class medical certificate. Now, instead of having to go back and get another medical certificate, I can ride out my third class privileges, which is what privilege category that I would degrade to once my medical has lapsed. And from then on, I would have 5 years or 60 months is how they measure it, from that date that I got my medical to get another one before my third class privileges have expired. So that's how it works. It's 12 months after the month of the date of your examination is how that's measured. Now, let's say that I was over 40 and I had a first class medical certificate. Now I have 6 months from the date that I got my first class medical before it lapses to third class medical privileges, in which case you would still have 18 months remaining of those third class privileges. With a third class medical, if you are under 40, you've got 60 months from the date that you get that to take advantage of all the third class medical privileges that you would have off of that certificate. If you are over 40, then that's just going to drop down to a 2 year certificate. And that's how the medical certificates work as far as different ages and how long they last. And now let's just go ahead and move on to talking about basic med. Basic med is somewhat new. You actually don't have to be seen by an aviation medical examiner. We call that an AME. And with a basic med, it's essentially the honor program. Um, you're saying that you are fit to fly, you've got a valid driver's license that is required, and you can't have failed any medical examinations. So let's say that you wanted to have a first class medical or even a third class, and now you failed that medical. You can't say, oh well, I'll just go get a basic med now. You have to you have to go and see another medical examiner or fix the deficiency of why you failed the medical, or you possibly wouldn't be able to get one if it was severe enough. But if you think that maybe I couldn't pass a medical and you don't try, or if you just don't want to deal with going and paying an AME and you just do a lot of recreational flying, you maybe own your own airplane, then a basic med might make sense. You're just leisurely flying. And that's really how a basic med works. You can never fly for hire if you have a basic med. That is one of the key things. There's different um, issues that come along with that are going to kind of limit you. You can't have more than 5 passengers. If your aircraft is over 6,000 pounds, you can't fly that. You can't fly over 250 knots, or in instrument conditions, you can't fly under IFR flight rules. Or what I was saying about basic med not allowing you to fly under IFR. If you are instrument rated and you hold a basic med, you are allowed to fly with that basic med legally at IFR. You just cannot uh, fly for compensation and higher. That's the limitation with basic med. What you need is you have to have held a medical certificate after July 15th of 2006. That's when they put the basic med rule into place. And you have to take an online medical education course that you can use to essentially do a self-evaluation. Like I was saying, it's the honor system. And then your driver's license, like I was saying before, that's what you're going to need for a basic. Talk about flying with a disability. Just because you have a disability doesn't automatically mean that you're going to be ruled out and not able to fly anymore. What this just means is you have to go under extra precautions essentially for a medical examiner to clear you to fly. And what this is, it's called a statement of demonstrated ability is what you would do. And in this event, a medical examiner would evaluate you and determine whether or not you would be able to still fly with your disability. And it acts very similar to a restriction that would go on your driver's license. So there are some people who require glasses to be able to drive their car legally, and this may not require you to wear anything or do anything differently, but it would be a restriction that would go on to your certificate. And this is not going to expire unless something adversely changes. So if a medical examiner is thinking that it could get worse, then maybe it wouldn't work out for you. But it can also change when you are maybe recovering from that, and you could get it lifted. So that's kind of how a flying with a disability would work, and the acronym for that is SODA, so a soda, if you will. Move on to talking about hypoxia. So first off, hypoxia just means that there is a reduced amount of oxygen, or it just means not enough oxygen. And there's four different kinds of hypoxia that you can get. There's hypoxic, hystoxic, hypemic, and stagnant. Now, hypoxic hypoxia is think of gaining a lot of altitude and then not being able to breathe. And that's not going to be because the oxygen is getting thinner or there's less oxygen available. Oxygen is getting thinner. There's less molecules required for that amount of pressure when you go up to certain altitudes, and that less amount of oxygen molecules for the required pressure is going to make it harder for your respiratory system to be able to pass these membranes back and forth. Um, when you are ascending and climbing to a higher altitude, you're just going to have a partial pressure for that oxygen that's required, and that's what's going to give you the effects of hypoxic hypoxia to hypemic hypoxia. So, hypemic means that there is not enough blood. So, this isn't a reduction of oxygen problem; it's a reduction of the blood cells, or the blood's not able to transport the oxygen that is needed to your cells in your body. And things that are going to cause you to get hypemic hypoxia are going to be if you have severe bleeding, if you've donated blood, because it takes a lot longer than you would think actually for your blood to fill back up to where it was before you donated it. It could actually be several weeks before you're back to a normal blood level at that time. And then things like anemia, blood deficiency diseases, things like this are going to make you much more susceptible to hypemic hypoxia. This is one of the main ways that you're going to really hear about hypemic hypoxia in aviation is going to be due to CO poisoning, and this we're kind of at greater risk for CO poisoning usually in the winter months when we'd be using the heater, because if there's any kind of crack in your exhaust manifold, that heat that comes off of the exhaust manifold to heat the cockpit could be leaking CO in there, and you would never know you're getting this deadly gas, and that could cause you to go into hypemic hypoxia, which could eventually cause you to pass out and crash the aircraft. So all of these hypoxia, different types of hypoxia, are very important to know about. And later we'll just talk about the signs of how you can understand that you are experiencing a symptom of hypoxia, and also what to do for your passengers if you see them, if you notice that they have signs of hypoxia. That we're going to talk about is stagnant, and stagnant means not flowing. So this means that you're losing circulation, or your blood is unable to move the way that it should be, and this is going to give you hypoxia as well. As pilots, the thing that we're most worried about when it comes to stagnant hypoxia is pulling G's, because this increased load factor on your body will cut off your circulation. And if you ever have the sensation of your arm falling asleep if you laid on it for too long, or your leg or something like that, that's going to be the same thing, is what you would experience with that. That's a form of stagnant hypoxia. So just think of stagnant as not flowing, and it's related in aviation to pulling G's. Last form of hypoxia that we're going to talk about is histotoxic hypoxia. And what this means is it's the inability of your cells to effectively use the oxygen that it's given. Things that are going to lead to histotoxic hypoxia are going to be drug or alcohol use. Things like that are toxic to your body are going to make you more susceptible to histotoxic hypoxia. There's been research that's proven that even a single ounce of alcohol could decrease your physiological altitude by 2,000 feet. So, where a normal person may need oxygen, or induced oxygen at, let's say, 12,000 feet, someone who has been drinking may even need oxygen when they're at an altitude of 10,000 feet. So things like this are why a lot of times you'll be limited if you're trying to drink on an airliner because the cabin pressure altitude that they've got set for the entire airliner is at a certain altitude, and if you drink too much, then you're at a risk of passing out or developing hypoxia. So really need to take these things serious, and there's just different ways that hypoxia can affect you, and that's one. We're going to talk about the symptoms of hypoxia, and these symptoms are going to vary for different individuals, so it's not a one size fits all thing or diagnosis. But one of the key things that you would want to look for is if you've got fingernails that are starting to turn blue, indicating a loss of oxygen. That's a key indicator. Or lips. There could also be your passenger or you may be feeling euphoria, which it would be really hard for you to really notice these symptoms in yourself, especially if it's something like euphoria. But you really need to be looking out for that, or lightheadedness, being dizzy, a headache, tingling sensations. All of these are signs of hypoxia. And if you notice any signs of hypoxia in yourself or a passenger, anybody on board, you need to immediately descend to a lower altitude, divert, get on the ground as soon as possible because it's an extreme risk flying somebody who has hypoxia. Um, get supplemental oxygen if you have that available. If you've ever rode on an airliner before, they give you the demonstration. If we lose oxygen, this mask is going to fall down. You need to put it over your face, do yourself first, and that really is important because you've only got a few seconds of useful consciousness if you are suffering from hypoxia. And as a pilot, you need to make sure that you recognize these signs and you're able to divert immediately and get on the ground somewhere. The factor that we need to talk about is hyperventilation. And hyperventilation has some of the signs or has some of the effects that hypoxia would also have. So it's very important to be able to eliminate hypoxia as being a factor, or if you are unsure, always treat hyperventilation as hypoxia and just get on the ground as soon as possible. But what hyperventilation is an excess of carbon dioxide being released from the blood. So that's going to be having an excessive rate of breath and really deep. So just really, really, really fast breaths. And when you get stressed out, when you're flying, things like hyperventilation can be happening, and a pilot may not even notice it. The reason that you really want to make sure that it's not a form of hypoxia that you're experiencing and it is indeed hyperventilation is you've only got a few seconds of useful consciousness when you're at certain altitudes. So, for example, let's say that you're at 45,000 feet, mean sea level, you're just cruising in the flight levels, and if you have hypoxia and you're not getting oxygen, you're only going to be conscious for the next 9 to 15 seconds. So, time is critical in this situation, and you need to find out, okay, if I'm experiencing hyperventilation, is my oxygen flow on my supplemental oxygen good? Go ahead and be able to narrow that out immediately. Now, if someone is just having hyperventilation, let's say that they're on maybe their first flight in a small airplane, something that they're not used to, and they start hyperventilating. Now, a way to remedy this is to talk aloud. The best cure and best prevention for hyperventilation is just breathing at a normal rate. So if someone is hyperventilating, you may want to just ask them to talk out loud, sing happy birthday song, something silly that's going to take their mind off of what's going on right now. Maybe even ask them to tell you their address, their phone number, or something that's going to get them talking and just breathing at a normal rate. It's going to be the most important thing that you can do for somebody that's experiencing hyperventilation. The middle ear and sinus problems. So the middle ear is a canal. So let's say that your eardrum is right here, and then it's got a tube going in, and then behind it is your middle ear, and your eardrum is blocking the pressure from it. It has to equalize. So there's a different pressure inside here of your middle ear than there is outside of where the eardrum is. It's like a filter going through. And when these pressures are unequal, that's going to cause that eardrum to either bulge inward or bulge outward, and that's going to cause you pain in your middle ear. Now, this can happen if you've got some kind of sinus blockage, or if you're sick, you've got a cold or something like that. These are going to be more prevalent, and it's extremely uncomfortable. And during a climb, if you're climbing and then you're losing, the air's got less pressure as you climb, right? So the pressure inside of your eardrum is going to be higher than outside. And if it's unable to equalize, that's what's going to cause that bulge. And one way that you can get rid of or allow your ears to equalize faster if that's not happening is you're able to pinch your nose and your mouth and just blow outwards, and just do it gently. Don't do it too hard, and that'll allow the eardrum to release that pressure from the inner ear and able to equalize that. It's going to take you out of that pain that you would be in. Moving on to sinus blocks. These are going to be the most painful during a descent, and this is why it's extremely important not to fly if you've got a cold or any kind of sinus infection, because it's just excruciating pain of the pressure differences and trying to equalize in your sinus cavities. Um, this is going to be with your upper respiratory infections, things like that. Just essentially, if you're sick, you don't need to be flying, because the pain that you're going to put yourself in these situations is not going to be worth it. It could also cause you to have a bloody mucus discharge from your nose once it finally does equalize out. So it's a very big deal. When you think that you might have a sinus block and you're already flying, something that you can do to make the pain a little bit less and just more gradual, just have a slow descent rate. Maybe you were planning on descending at about 500 feet a minute before to come to land, and now you've noticed you got a sinus block. So let's maybe dial it back. I'll descend at 200 feet per minute, and we'll get there a little bit slower, and that's going to give your body more time for that sinus to equalize, and it's going to keep you from being in nearly as much pain as you would have been before. Spatial disorientation now. So spatial disorientation is good. It's what's going to happen when your three senses aren't agreeing with each other. So when you can see the horizon or you can just see outside, a lot of times your visual senses are going to take over, and that's going to prevail over anything else. But let's say that you are flying in a cloud. You're in IMC conditions, instrument meteorological conditions. That's what IMC stands for. And all of a sudden, your visual senses are gone. You can't tell where you are in relation to the rest of the world, and this is going to make you very disoriented. And in times like this, you're really going to have to have to understand that you have to rely on your flight instruments to get through that. But how this works is your visual senses go off of your eyes, which makes sense, and then your um, soma to sensory system is your postural. And what this is your nerves and your skin and your muscles, and it's going to really send to your brain the effects that you would feel from gravity. So, I can tell that I'm leaning left now because I feel like I'm leaning left. That's your soma to sensory system. And then you got your vestibular system. Um, this is going to be the inner ear that we were just talking about. There are, well, we were talking about middle ear, but inner ear has these hairs that are shaped like an onion, and there's fluid inside of your inner ear. And when you turn, these hairs go with the direction of the fluid and then equalize themselves out. And um, when you're disoriented, inside of your ear, those hairs could be messed up, or you could have too much fluid on one side, or if the inner ear gets used to a certain turn, maybe it would be stuck in a position, so it would be thinking that you're stuck like this, when really maybe you're like this. So to correct for that would potentially be deadly if you're flying an airplane and you can't see anything. So that's how your vestibular system is incorporated with spatial disorientation. Now, when this really is an issue, like I was saying before, all these three things can't agree with each other and that conflicting information. So it's really important not to fly into IMC as a VFR pilot, visual flight rules pilot, VFR, because your body is just going to go crazy if you don't have the proper training beforehand. So this is just a few examples of spatial disorientation, and we're going to talk some more about illusions that are involved with these uh, with spatial disorientation, which essentially is what it all is. But we've got different illusions that are broken down into the different parts of it with your vestibular system, your visual system, and your somatosensory system. Somatosensory system. We'll call that the postural system because it's based off of your posture. It's easier to say. All right, and then now let's move on to different kinds of vestibular
The different
illusions.
kinds of illusions that we can have with these different systems that our bodies are using. With the vestibular system, you've got your inversion illusion. Um, that is just going to be the feeling when you're going from a climb and then you're leveling off to straight and level. You could get the sensation of tumbling backwards, and that's one of the that's why it's called the inversion layer, is because you feel like you're going backwards when you're really just in straight and level, and you may want to recover from that by pushing the nose down more. And if you do that, all it's going to do is just intensify that illusion that you're having of tumbling backwards. And then you got a Coriolis illusion. So earlier we were talking about the onion shaped hairs that are in your ear and that they go back and forth with that fluid. Well, with the Coriolis illusion, you're going to be in a turn long enough to where your inner ear fluid, it got adjusted to where it's maybe over here right now. And then you're just going to think that when you level off, maybe you're still in that turn because your inner ear hasn't told your body, your brain yet, that you're back in straight and level. And that's what the Coriolis illusion is like. With the elevator illusion, it's going to be the feeling of maybe you hit a little bit of turbulence in an updraft and you feel like you're just significantly going up a lot. Then that's going to be one effect of an elevator illusion. And then the same thing can happen if you get a downdraft. You may feel like you're descending a lot. That's another vestibular illusion of your body not really understanding what's actually happening. It's just getting these senses and trying to make sense of it all. Um, with the false horizon, a lot of times this will happen if you've got a poor visibility situation. Maybe there's some haze out there or something, or especially at night, there could be different lines of lights, and it could look like you've got um, a line of lights that's going this way, and then a line of lights that's going this way. And this may be your horizon, but if this looks straight to you, that's going to be the horizon that your body's going to want to make be the actual horizon when it's really not. And that's going to lead you into a dangerous attitude, referring to the attitude of the airplane, not your actual attitude. And another one is going to be the leans illusion. With that one, it's going to be a sudden return to level flight when you've been in a prolonged turn. So it's kind of like the Coriolis illusion, where your inner ear just gets used to that turn that you're in, and then you abruptly come back, and now it thinks that you're in that turn, so you want to correct for it in the opposite direction. So that's an issue. Autokinesis is another vestibular illusion. With autokinesis, if you've ever been driving at night or just outside looking up and you see a really bright star, maybe, or maybe it's a satellite, something. Regardless, it's a light that's not moving. But the longer you stare at it, the more you're going to start to think that it's moving, especially if you're in an airplane at night where you're also moving. it's very easy to think that something that's just a star maybe is another aircraft coming at you. So that's another thing to really be aware of when it comes to these illusions. Next, we've got the graveyard spiral. So this is going to be when you're in a prolonged coordinated turn, um, and maybe you're just getting a little bit more bank as you're going in this prolonged turn. And we know when you have a higher angle of bank that you're creating less lift. And that less lift is going to make you lose altitude. Well, when you notice that you're losing altitude in your graveyard spiral, you may try to pull up because you think you need to gain some altitude. Well, really, when you've got this increased angle of bank, you're pulling up, and that's going to tighten that spiral, and it's going to make you lose even more lift, and you're going to start going into what they call a graveyard spiral, and that's really bad. That's going to kill you. So, really be conscious of what's going on when you've um, could suspect that you're having an illusion, and really be looking out for an illusion to make sure that your body isn't playing tricks on you. And now we can move on into our somewhat gravic illusions and graveyard spin. Gravic illusion, what that's going to do is give you a feeling of being pushed back into your seat when you apply throttle. It's going to give you the feeling of being in a nose up attitude when you really may not be. It may just be from the acceleration just pushing you back. It can also go the same way if you are decelerating and you're going forward. You might think you're descending. So that's something to really be aware of. And really, when it comes to these illusions, you want to be able to prevent them. And a way that you can prevent these illusions is just avoid flying in reduced visibility situations. If the horizon isn't available and you're not an instrument rated pilot, it's not a good idea to go. These illusions are just waiting to take advantage of you. You really need to understand that it is okay to rely on your instruments, and you'll learn more about that as you become an instrument rated pilot about how critical it is to be able to fly solely off reference to the instruments. On to motion sickness. And motion sickness is just your body disagreeing with what your receptors are telling it. So your brain doesn't agree that your eyes are seeing what they see or that your body is feeling what it does, and that's going to cause you to get a little bit sick, and it could lead to vomiting, paleness, being sweaty, just general discomfort and nausea, which would lead to the vomiting. With treatment for this, you just want to be able to get as much fresh air as you can. Maybe check your airspeed, open the window in your airplane if that's possible, and just get some fresh air going. Just also make sure that you're able to focus on something outside of the airplane, and that's going to help you a lot as well. And we've also got carbon monoxide poisoning. So CO poisoning, carbon monoxide, is something that's very dangerous because it's a colorless, odorless gas that will kill you. It's going to be able to attach itself to your blood 200 times more easily than oxygen. So it's your body's basically begging carbon monoxide to come into it, and it can take up to 48 hours for your body to rid itself of that carbon monoxide. And the best way to combat carbon monoxide poisoning is you just want to have some kind of detection device inside the cockpit. I know today there's a lot of different things you can use. There's a little discoloration tab that you can stick up on the dash, or you can get a Stratus or a Sentry, and that's got carbon monoxide detection on that as well. Symptoms of carbon monoxide is going to be dizziness, blurred vision, drowsiness, loss of muscle power. And how you're going to treat that? Same thing again. Open the window, cut off the heat, because that's most likely where any carbon monoxide poisoning is going to be coming from, is from your heater, because that's giving you the heat that's coming off the exhaust manifold through your vents. So you could have a leaky exhaust manifold that's producing that carbon monoxide. Now let's talk about stress. Stress, there's two different kinds. There's chronic and acute. So with acute stress, that's going to be your short-term stuff. So think of taking a test. I've been really thinking about this test all week long, and I'm stressed that I'm not going to make a good grade on it. That'd be an example of acute stress. Now, chronic stress could be maybe someone who's in a lot of financial debt, or there was a death in the family, a divorce, something like that, that's not really a short-term problem that's going to cause a lot of stress that could really affect you, especially in your flight training. um, with that, you're just going to have to be able to mitigate it or let it pass if it's chronic. So maybe you need to take a break from flight training for a while, get your mind right with those. Now with fatigue, you got acute fatigue that's going to come from just everyday living. You're tired at the end of the day. That's an example of acute fatigue. Or maybe you've been flying all day long and you're really worn out from it. A cause from that would be just physical stress, physiological stress, just just living. Some symptoms that are going to come along with that fatigue. You could have errors in your timing. You could be negligent to certain things, maybe just not paying attention, not as sharp as you would normally be due to that fatigue. And then you've got chronic fatigue also. Chronic fatigue, it's kind of like with the chronic stress, it's just something that you're really tired all the time. You might not know what's causing it. Things like this usually are going to need a physician to help you out to be able to mitigate that chronic fatigue. Symptoms of that are going to be weakness, tiredness, really breathlessness, headaches, and just really irritable, being really irritable. Another thing that we could talk about now is dehydration. Dehydration is pretty self explanatory, especially here in Texas. We have really hot summer months. So when you're flying around, a lot of these aircraft don't have air conditioner. So you might be stuck in this airplane when it's 100 degrees outside with no air conditioner, and that's going to really take a lot of fluids out of you. So it's very important to be hydrating all the time. It's important to hydrate regardless of whether you're flying or not. It's one of the most important things you can do. But especially in flying, when it's so critical that you are on your A game at all times, you could fall victim to heat stroke, and that's something that you're not going to want to deal with. With drugs and alcohol, best policy is just stay away from it. With drugs, you want to make sure that you're not taking anything that is in question, or if you do have a question about it, don't take it and refer to your AME, your aviation medical examiner, to make sure that you're not going to be violating any of the FAA's rules. Because the last thing you want to do is take something that's going to get you grounded or pull your certificate. With alcohol, we know that it impairs vision. That's why it's illegal to drive under the influence of alcohol. Same thing for flying, except you want to mitigate that even more so from flying. The rule is 8 hours from bottle to throttle, and whether it's been 8 hours since your last drink until you get into the aircraft, you still need to make sure that you've got less than 0.04 blood alcohol content. Um, Alcohol gets into your bloodstream very easily. It absorbs about 80 or 90% of the alcohol that you drink within like 30 minutes. So really take that one to heart. You don't want to jeopardize your career over a drink. And with scuba diving, think about pressurization or pressures equalizing, just like we were talking about with climbing and inner ear type stuff, middle ear, and that's going to be equalizing the pressures of outside the eardrum and then inside where the middle ear is. Now, scuba diving is the same thing except you're going down instead of up. So if you are scuba diving and you were able to not take decompression steps on the way that when you're coming back up, then you just need to wait for about 12 hours before you go to fly. If you were taking those non-decompression steps, so you're coming back to the surface and you're having to stop to make sure that you're giving your body time to equalize those pressures, then you're going to want to wait 24 hours before you fly because it's just too dramatic of a change. When you're going from below sea level to well above it, your body's not able to adapt to that quick enough. And then if you are going to fly, regardless if you had decompression stops, non-decompression stops, or not, you want to make sure that you're not flying over 8,000 feet MSL for at least that 24 hours. And this concludes my lesson on aeromedical factors.